My presentation is titled Utilizing Disease Registries to Scale Up Neurology Research in Africa, Experience from the Nigeria Parkinson Disease Registry. Congratulations to the conference organizers and thank you for inviting me. I present on behalf of the Nigeria Parkinson Disease Research Network and our collaborators. I have no relevant disclosures. Parkinson's disease is the fastest growing neurological disorder globally. According to the 2016 Global Burden of Disease study, between 1990 and 2016, Parkinson's disease grew to become the leading source of disability worldwide. And here we see a comparison of the number of persons affected with Parkinson's disease in 1990 compared to 2016, based on the data from the GBD 2016 PD collaborators. And we note the more than double increase in the number of affected persons, the disability associated with Parkinson's disease, and the number of deaths. Ray Dorsey and colleagues have described Parkinson's disease as an emerging epidemic. And in their publication from 2007, they projected a doubling of the number of persons with Parkinson's disease from 2005 to 2030. Specifically, the study projected the growth rates in the number of persons aged above 50 in the most populous countries of the world, including Nigeria, to either increase by 50 to 100% or exceed 100%. Despite the apparently enormous and growing burden of Parkinson's disease in Africa and worldwide, the research output has lagged behind, and this is also true for other neurological disorders. There are several reasons why research on neurological disorders within the continent of Africa are imperative. A recurrent theme in reports of burden of disease has been the relative scarcity of prevalence and incidence studies, with a few available often critiqued for their quality. And this mars robust estimation of true disease burden and may result in an underestimation and an erroneous impression given to policymakers regarding the importance of these disorders. African populations are notably underrepresented in cohorts participating in clinical trials and genomic studies, and this has both scientific and ethical implications. The effect of genomics on our pharmacokinetics and the importance of gaining new insight into disease causation offered by the unique genetic diversity of Black populations of African ancestry is strong reason to ensure inclusion. Environmental influences on the expression of neurodegenerative diseases are also of importance and underlie the need to truly have geographically distinct populations involved in research. Disease outcomes can be influenced by health disparities, which are fueled by social and biological factors that also merit studying in our populations. And in illustrating the state of neurological research in Africa, I will use the example of the status of Parkinson's disease research. There are many health disparities that need to be understood in Parkinson's disease. The importance of disease progression markers in PD is also an area that is critical, that requires research. Genetic and environmental risk factors, disease pathology, clinical trials, research on service provision and health systems for PD burden are all unmet needs in Parkinson's disease research that need to be addressed. As I earlier alluded to the representation of Africa in neurology research publications is low, and this can be demonstrated using the status of PD research in Africa. Specifically for Parkinson's disease, the frequency of publications relative to other continents, for instance, epidemiological, genetic studies, clinical trials, and cohort studies, ranges from 2.6 to 5.7% of the global representation. Characteristically, publications have included single institutions, small cohorts, limiting the generalizability of the data. And we have emphasized that exploring PD heterogeneity in Africans offers us many unique opportunities as researchers to unravel disease mechanisms and reduce health disparities. This graph illustrates the low numbers of persons with Parkinson's disease included in publications in Africa, Asia, North America, or in Africa relative to Asia, North America, Europe, South America, and Australia. This graph captures the number of Parkinson's disease cases included in publications on PD in Nigeria over the time course of several years. And we can see that on average, typically most studies would include less than 80 or less than 100 cases. Driven by the philosophy that we can go farthest only if we go together, and in order to scale up clinical Parkinson's disease research in Nigeria, we established the Nigeria Parkinson Disease Registry in 2016. The initial experience from the registry was published in the Movement Disorders Journal in 2020. Here we present the methodology and the initial results from that registry. The Nigeria Parkinson Disease Registry was established as an institutional pilot in November 2016 and subsequently expanded to include neurologists nationwide. The registry uses a hybrid electronic and hard copy anonymized minimal data capture form to register consenting participants, and an extensive research database is linked to the registry and incorporates additional demographic, clinical, and biological data. Uniform diagnostic criteria and standardized assessments for disease-related phenotypic characterization are applied across the network, and all research undertaken by the network has research ethics approval. Nigeria is comprised of 36 states in 6 geographic regions and a federal capital territory. The collaborating neurologists in the registry are practicing in these tertiary hospitals where specialist cases including Parkinson's disease are seen in each of the states. At present, we have coverage of all 6 regions, including 32 states and the federal capital. As of January 2021, the registry had enrolled 1,077 Parkinson's disease and 1,087 matched controls from 47 participating neurologists. The geographic distribution by state of origin of the PD participants includes all 36 states and includes all majority Nigerian ethnic groups and at least 15 of the ethnic minority groups. Recruiting sites are located in 32 of the 36 states and the Federal Capital Territory. So this is the same graph previously presented, but now displaying a data point including our recent registry paper. The registry approach has enabled us within a relatively short time to accumulate a robust sample size for more credible and representative clinical research in Parkinson's disease in Nigeria. This strategy is being expanded currently within the continent by our group, and we hope that we can achieve the same level of success and cooperation. The strategy also seems attractive to research sponsors and is the basis for an ongoing research grant sponsored by the Michael J. Fox Foundation, and we hope for future grants also. It has also created a platform for other related interventions, including mentorship, continuing professional development, public awareness, and community engagement. In conclusion, a registry-based approach is a viable strategy for scaling up neurological disease research in Africa by increasing participant accrual. The administration is not necessarily cumbersome and can be driven from within African institutions. The process is not without challenges, but these can be overcome with leadership, cooperation, collaboration, and funding. I acknowledge all the participants in the registry and all our collaborators, and the Michael J. Fox Foundation, who are the current sponsors of our Nigeria Parkinson Disease GWAS studies. Thank you.